Good.
Boy, I love it. All right, Chris, thank you. Well, brand new at 8 o'clock and To Your Health, clearing up the confusion about COVID-19 versus allergies. Since some of these symptoms are similar, what do you do to treat them, and when should you seek treatment? We're joined with Kevin Ralls. He's a doctor of the nursing practice for American Family Care, which does have more than 10 locations in the metro area. Good morning, Kevin. Good to see you.
Good morning. Great to be with you.
Now, let's start with the symptoms that are strictly COVID that aren't allergy.
Right. So there'll be some pretty strict things we want to look for. The two main ones I think we'd say are high fevers and loss of taste and smell. Those are things that we typically don't see with allergy symptoms, and those would usually prompt us wanting you to get a COVID test.
Now, when you say you lose your sense of taste, is that incredibly noticeable? I mean, will people be like, huh? Like, my favorite foods don't taste the same. Like, will it be like, even if you start your day off with a cup of coffee and that doesn't taste the same, or is it slight?
That's correct. And, there can be a little bit of loss of taste and smell that you'll see maybe with some sinus congestion. We're talking about some pretty profound loss of taste and smell. Some people will even say, well, I tried a teaspoon of hot sauce and I couldn't taste that. Wow. So that's pretty much, what we would recommend. And over here at American Family Care, we'd be very happy to, discuss some of those symptoms if somebody's just not sure and would like to have an opinion on whether to get a test or not.
No, and that's exactly what people need to do, is reach out and ask those questions. Now, what about the symptoms that are strictly allergies but rarely COVID?
Sure. So that's also an important distinction. Symptoms such as, sneezing, itchy, watery eyes, runny nose, those are usually kind of the hallmarks of the average allergy symptom. Again, feeling terribly ill is usually not consistent with those seasonal allergies. So again, when we're having those fevers, and loss of taste and smell, just feeling ill would be the reason we would want you to consider getting a test.
Now, when I reached out to talk about what my body was doing to me, I found out that, your body can become more allergic to certain pollens as you get older, so your body can actually change, which I thought was incredibly fascinating. I thought I was always not allergic to pollen certain times of the year, and then all of a sudden I'm stuffy. But there's also other things that we do that can also trigger some of these, and one of these, you recommend that we don't have to make our beds anymore. Is that true?
Yeah, so we've actually seen some studies which are kind of interesting, not to get too icky, but, there's normal dust and skin mites that we have that live on parts of our body, and those also are apparent in our beds. So some of the studies actually suggest that we let our sheets air out prior to, kind of making them immediately. That may reduce the risk of triggering some of those allergies and might make people feel a little less symptomatic.
Boy, and it was interesting, too, like you were saying, even using the dishwasher and eating certain fruits and vegetables can cause some issues with this. But we appreciate your information this morning. And like you said just a couple of minutes ago, you guys are there to take these questions. If people have questions, there's 10 of your offices around town, and we know that they're going to reach out and ask those questions. So thank you for bringing it to us today.
Absolutely. And come see us at American Family Care. Myself and my colleagues are always happy. As it is, COVID's out there too. So just that, those similarities are very close. We're very happy to help clarify any way we can, help people out.
We appreciate it. Thank you so much.